My name is Nadia Teis. I'm a student at the University of Brownsville at the College of Nursing. I'm doing my master's program, and this is a physical assessment that is going to be performed on a DVD format in partial fulfillment for the course of Advanced Health Assessment imparted by Dr. Beatriz Cabrera. Good evening. My name is Nadia Teis. I am going to be doing your physical today. I read your information, and you don't have any chronic illnesses. So we're going to proceed to do an examination from head to toe. We'll start from your head all the way down to your toes, and we're going to start with your skull to make sure that there is nothing abnormal and you have a normal cephalic skull. Then we're going to go to palpate your temporal arteries, and next we're moving to your temporal mandible. And can you open your mouth and close? Do you have any pain or any problems there? Another thing that we're going to do is we're going to check your motor movements to look at your cranial nerve, the 5th and the 7th. Can you close your eyes very tight? And I'm going to remove your glasses and make sure that I am not able to open them. Close them very tight. Okay, very good. Do you feel as I'm going through your skin? And I'm observing that you have asymmetrical features. Your skin has no lesions or discoloration. Your nose is symmetrical also. And I'm going to ask you to make some movements of your muscles in your face and to make some gestures. Can you wrinkle your forehead? Either that way or like this, okay? Very good. Can you smile? Very good. I'm going to proceed to palpate your sinuses. Do you have any pain or any tenderness in those areas? And I'm going to do some percussion. How about there? Do you have any tenderness? No. Okay. For your sensory portion of the trigeminal nerve, I am going to be checking your face. You can tell me if you feel this is a little sharp. No. And this is soft. Yes. So can you feel that? You say yes?
Yes.
How about here?
Yes.
Here?
Yes.
Here?
Yes.
Here?
Yes.
How about this? Can you feel that?
Yes.
That?
Yes.
Here? And here? Okay. Now we're going to proceed to examine and palpate your lymph nodes. We're going to go to the pre-auricular and your post-auricular area, the occipital, the submandibular, and your superficial clavicular and your supraclavicular nodes. And there is no masses or lymph nodes that are abnormal. Okay, now I am going to proceed to auscultate for the carotid and the carotids and the bruit. And for that, I am going to palpate on both sides. And I'm also going to use the stethoscope to listen to the bruit. And again, the exam is normal. We are going to test the spinal accessory nerve, the cranial nerve 11, and I am going to ask the patient to raise your shoulders and do it with force, so don't let me pull down. The cranial nerve 11 is intact. And now we are going to move to the eye examination. And we're going to look for visual acuity. If I had a Snellen chart, that's how I would be testing the visual acuity, and would ask the patient to read the letters that are the smallest and proceed from there. So far, her visual acuity, the patient requires to wear glasses. So this could also alert us to send the patient to be seen by an eye specialist. Then we are going to examine and observe for any abnormalities with her eyes, the conjunctiva, the sclera. Everything looks normal. She doesn't have, her eyes are moist, and she doesn't have any visual abnormalities that you can see from just the eye. We are going to be observing and examining the extraocular motor nerves, the cranial nerves 3, 4, and 6. To continue with the head and neck examination, we are going to examine the ears. And you wanna examine for the outer ear for any pain. The outer ear canal looks normal. There is no sensitivity, no pain, no nodules that can be felt. And then we are going to proceed to examine the inner ear. The inner ear looks normal. There is no bulging, no redness. And they're both bilaterally normal, with no bulging or no redness. No exudate. Now we're gonna continue to examine the visual acuity. As I already mentioned, we would be probably using this Snellen chart, and we'll have the patient read the smallest that she can read on the Snellen chart. The other thing that we are gonna do is we are going to observe for the extraocular motor nerves, which is your cranial nerve 3, 4, and 6. So we're gonna proceed to examine the extraocular motor nerves. We are gonna do the 6 cardinal positions of gaze, which is to follow my hand with your eyes. 3, 4, 5, 6. And now I am gonna ask you to look at my finger and to look in far. And I'm gonna be looking at your reaction to light. Ideally, we would do this exam with the lights off, but for the purpose of this video, we're gonna leave the lights on. If you look up here and look at a point back there, her pupils are reactive to light asymmetrically with no abnormalities. Now we're going to proceed to do the fundoscopic exam. We are going to examine the eye. If you can look up to a point, and we are observing for the red reflex. The arteries and veins appear normal. There is no signs of hypertension. There is also on the fundoscopic exam, the optic disc looks with no lesions, and it's clear. Now we're going to conduct the examination for distinguishing whether there is hearing loss that could be sensorial or conductive. For that, we are going to use the tuning fork, that when you do this, you can hear, and that when it's placed in the appropriate area of the head and the bones of the head, you will be able to distinguish if there is a hearing loss on either side of the ear that is louder or lower, and will tell us whether it's conductive or sensorial. Now we are going to perform the maneuver. Can you hear it?
Yes.
Okay. And you place the tuning fork on the top of the head, and that conducts the vibration to the bones in the ear, and also the sound. Can you hear that?
Yes.
Which side do you hear it louder, or is it the same?
This
This one you hear it louder? Now we are going to do the right maneuver. which you place the tuning fork on the mastoid bone. Can you hear that?
Yes.
And you do it on bilaterally and place the tuning fork. And here, can you hear that?
This time it was the same.
It was the same? Okay. So that can tell us where it's conduction or sensorial. Okay, now we're going to move forward to examining the glossopharyngeal nerve and also the vagus nerve. We're gonna ask the patient to open her mouth and to stick her tongue out. And when we do that, we are looking for any deviation of the tongue to see any damage on either side of the nerve. We're also gonna ask her to say ah, and we are going to elicit the reflex of the vagus nerve, which she does have it, so there is no abnormality with these two nerves. We're gonna proceed to inspect the oral cavity, in which we're also going to examine cranial nerves 9, 10, and 12. We're gonna ask the patient to open her mouth, and we are going to inspect the soft and hard palate. We are going to ask the patient to stick her tongue out and to say ah. Also, we're gonna ask her to swallow and stick your tongue out and move it from side to side. There is no observation of deviation or fasciculation of the muscle of the tongue, and the exam on those 3 cranial nerves is normal. Now we're gonna proceed to doing the assessment of the lungs and the thorax. For the purpose of this video, we have not asked the patient to take her clothes off or to use a gown. We're going to do this superficially over her clothing. And we're just gonna start by palpating for tenderness. And do you feel anything that is painful or uncomfortable? There is no tenderness. Her diaphragmatically is the patient is asymmetrical. There is no deformity. We are going to ask the patient to say the word, the numbers 99, and we are going to auscultate. Can you say 99?
99.
Again.
99.
Again.
99. 99. 99. 99.
Now I'm gonna ask you to say the letter E.
E. E. E. E. E.
Well, I'm gonna ask you to just take deep breaths to auscultate for any consolidation, any rhonchi, or any wheezing. And so far there is no abnormal findings. We are going to tag for Fremitus. Can you say the word 99 again?
99. 99. 99.
And we are going to assess for any tenderness there? No? Okay.
So take it from the top.
We're gonna proceed to inspect the lungs and the thorax. We are going to ask the patient to respond to any, no, forget, tell me. We're gonna proceed to examine the lungs and the thorax, and we are going to start by inspecting the thorax of the patient, and we are going to ask the patient to take a deep breath and palpate for the diaphragmatic excursion and also so we can assess for asymmetry. The next thing we are going to do is that we are going to palpate and ask the patient for any tenderness or any discomfort. And the next thing is percussion. We are going to do percussion to assess for any consolidation, any fremitus. Forgot the last one. And lastly, we are going to do the auscultation with the stethoscope to say the numbers 99.
99, 99, 99, 99, 99,
And also to say the letter E.
E, 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 E.
And as of right now, there is no abnormal findings in the thorax and the lungs inspection. The anterior thorax, in which we also look for asymmetry. We do also percussion. And for the purpose of this video, we are not going to examine the breast. However, that would be when we examine the breast. We also would examine for the axillary lymph nodes. We would auscultate again, so the breath sounds. Can you take a deep breath? Okay. And then we will proceed to auscultate for the heart sounds. When we are examining the, auscultating for the heart sounds, we are looking to detect any abnormalities such as murmurs. And there are 5 areas of the heart that we would like to assess, and one is the aortic valve, the pulmonic valve, we also want to check the Erb's point, and the tricuspid valve and the mitral valve. Now we're going to inspect for peripheral pulses, and we're going to start with the carotid. And we're going to go to the radial pulses. And we're also going to inspect for any edema, any abnormalities of pedal pulses, for the skin color, and any lesions. Also, we're gonna inspect for varicosities. Now we're gonna proceed to inspect the abdomen, and we're gonna look for also asymmetry. We're gonna look for any scars, any masses that are out of the ordinary, and we are going to first auscultate for our vowel sounds. And this is due to the fact that once you manipulate the abdomen, you can alter the vowel. So you auscultate for the 4 quadrants. And her vowel sounds are normal. We are going to auscultate, and we are going to palpate for inguinal nodes, lymph nodes. We also are going to do palpation, and in palpating the abdominal cavity, we can find any signs or symptoms of appendicitis, gallbladder, a mass that is abnormal. And so we also want to palpate for the inguinal nodes, lymph nodes. And so it is important to palpate in the inguinal area. We can also assess for rebound tenderness. For do you have any pain? Did you feel any discomfort? And this is we're going to go to the examination of the musculoskeletal system, and we are going to be observing and inspecting the ability of the patient to have good range of motion, movement. And one of the things that we are going to do is ask the patient to engage in these movements, and we palpate for the joint movement. We also are going to ask the patient to move her arms in a circular manner to assess for range of motion. And we are going to test for muscle strength. We're going to ask the patient to lift her shoulders and to go against my first, you go like that, and okay. You also are going to ask for the patient to squeeze your hands for strength, and we are going to ask to press against my hand on both extremities to see for any differences in the strength on bilateral size. Okay. Now we are going to inspect for her gait. Can you please stand up? And also for her overall posture, we are going to look at the patient, and we're going to ask to take a few steps. Okay, that's enough. If you can return, there is asymmetry. We're also going to inspect her column for any scoliosis. And part of the things that we have to do is check for any abnormality in her back. For this part of the exam, we ask the patient to lean forward to inspect the column. And we also ask the patient to lean to a side and to the other side to observe for range of motion and to see any deviation of the column. We also can inspect at this time and ask the patient to rotate her lower extremity, the one at a time, outside and one inside, to observe for range of motion. And we ask also to turn the lower extremity, the foot, to the outside and to the inside. Also, for abduction and adduction, you have to extend your leg to the right and inside, and now the other one to the right and inside. And you also want to observe the patient. Put your leg to back. Another test that is performed to assess the musculoskeletal system is the Romberg test. What you do is you ask the patient to close her eyes and to extend her arms, and you want to stand behind the patient in case they lose their balance. Because if they lose their balance when they close their eyes, that means that there is an abnormality in the cerebellum. Another test that is performed to assess musculoskeletal system is the Romberg test. This test, you would like to stand behind the patient in case they lose their balance when they close their eyes, and so you instruct them to close their eyes and to extend their arms. And in the event that they do lose their balance, that means that there is an abnormality in the cerebellum, such as ataxia. Okay, now we're going to do a mental status exam, and we are going to start by asking the patient what day is today. Do you know what day is today?
Yes, today Today is April the 29th of 2015.
What day of the week is today?
Today is Wednesday.
Do you know who the President of the United States is right now?
Obama. Yes.
And do you remember who the president was before Obama? Can you say the word world backwards?
DLOW. Wrong. 7, 8,
Subtract 7.
Oh, okay.
Subtract 7. Yeah.
20 minus 7.
Mhm.
Okay, it will be 13, and then it will be.
Another part of the motor assessment is the deep tendon reflexes, and this is used to detect any hyper or hyporeactivity, to assess for abnormalities to the neuromotor system. One of the reflexes that we test is the triceps, which is you ask the patient to flex her arm and you percuss with the hammer on the trigger point. Another one is the biceps, where you also can use the hammer for the trigger point, which is right in the cubital area. The other one will be the radial point, which you also percuss with the hammer. And then we go to the patellar reflex. And the last one that we have here is the ankle reflex. There. Babinski reflex, we're going to ask the patient to lay down, and we are going to use the bottom part of the hammer to elicit the reflex, which goes from the heel all the way down, and from the heel all the way to the plantar area. If this was an abnormal finding, there would be hyper extension of the great toe. In an adult, that is an abnormal finding. In an infant, it is appropriate. Another aspect of the neurological disease is to elicit the reflexes of the abdomen. This is to detect any abnormalities of the central nervous system or peripheral nervous system. And this is performed going from 4 points with a cotton applicator. You can stroke from the bottom area to the middle, to the umbilical, and from the top to the bottom. And this you're observing for muscle contraction. With this, we conclude the head to toe assessment. Thank you.